Hello everyone, this is Dr. Liz here in Victoria, Texas, and today we're going to talk about ovarian health. The reason that I'm talking about this topic is because I'm seeing a lot of patients in my practice as a naturopath physician that they come to see me after seeing several doctors, even including gynecologists, and they're treating or they have been treated for digestive issues. A lot of women, they come and they say that they have like heartburn or acid reflux or gas or bloatiness, that they get to the point that they cannot eat anymore. They have problems with constipation, pain during intercourse, the abdomen start growing really big, like they feel like they're pregnant. They have sciatic pain. So all those symptoms, if you're having that, please ask your doctor about a simple test that is called CA125 antigen, that is a blood marker that is similar to the one that the doctors ask when somebody, a man especially, has prostate issues. For men it's called PSA, but for women it's called CA125 antigen. So don't be conformed just with the pap smear that the doctor do every year to check your cervix and the uterus. You need to check that part because the ovarian area has the ovaries, the tubes, the uterus, and the vaginal area. So when you start having problems in these two ovaries, they start growing, and when they start growing, they give you symptoms in the digestive tract, and that may confuse a lot of doctors. So that's what I'm calling attention over this part. So one of the symptoms I already mentioned to you, it can be as a single ovarian cyst that start growing, feeling like almost like you're pregnant. You may have tenderness in the breast, discomfort in the abdomen, pelvic pain, pain in the lumbar area, pain in one hip. It depends if the ovarian cyst is on the right side or on the left side. You have sciatic pain, and you feel like your abdomen is growing and is bloated all the time. And when you eat, you feel acid reflux, heartburn, gas, and you think that it's because of the food that you're eating, but it's because your ovarian is growing too much, causing pressure over all your digestive tract. The other thing that you need to be careful is like sometimes it's just not one ovary that start having one cyst, but also start having several cysts. So instead of just growing like that, it start producing several, like a cauliflower. And that can cause also issues in the pancreas, causing insulin resistance. And that causes metabolic syndrome, that you start gaining weight for no reason, and you say, hey, I do exercise, I do a good diet, but I still can lose weight. So that can be connected to polycystic ovarian syndrome. Some women experience facial hair that's really abnormal, because if you have perfect levels of estrogen and progesterone and also the male hormone testosterone, you're not supposed to be growing hair in your facial area. So that's another symptom. Another thing that is really common in that part is acne. Some women come to see me, like last week I have a woman that she's 35, she already have 3 children, and she started having breakout for the last 3 years, and it's because of that disruption in the hormones. So one of my recommendations is to watch your diet, because the meats that we eat today are hardly injected with hormones that are causing disrupting in our own hormones. Things that has a lot of sugar, not sugar from fruits and vegetables, but sugar from bread, from ice cream, from soda, and then dairy products. Milk and cheeses, they're also cause upsetting in the hormone production. Today we have a lot of stress, and before I've been telling you that when our body pH is highly acidic, it set up the perfect field to start growing even an ovarian cyst that can be benign, or the worst X scenario that will be an ovarian cancer. That's my main concern, and that's the reason that I'm talking ovarian health, because I've seen a lot of patients that they're being treated for digestive issues, and what they're doing is they're sitting in an ovarian cancer, and that's really sad. That is a problem that can be highly preventable, but because of overlooking at it, people are dying from that. So another thing is to do exercise. When we exercise, we put more oxygen in our body, and higher levels of oxygen kills cancer. So that's really healthy to move your body, because if you don't move it, you lose it. And then another recommendation, we've seen that a lot of young girls, they start using birth control at a young age. Those are synthetic hormones. All women that we go close to menopause, we start using hormone replacement therapy to protect our bones from osteoporosis, but then we end up with ovarian cancer or breast cancer. So the remedy becomes worse than the benefit, right? So avoid all those things and trying to do natural remedies. So that's my recommendation. So a lot of problems with ovarian health is connected to the thyroid. The thyroid is the main gland that connects to other glands in our body. So when the thyroid is out of balance, it can mess up the ovarian area. So you can take a thyroid supplement. There's some patients that I've seen that they have thyroid issues and the blood test can be normal. And that's called subclinical thyroid disorder, that the blood test is perfect, but you have symptoms of thyroid issues. So one of the main things is like low body temperature or high temperature, that you feel hot all the time or cold all the time, or cold hands and cold feet, because the thyroid gland is our body thermostat. So when that is out of balance, even if the blood test is normal, that's a good indicator that we have problems with the thyroid. Another thing that I use in the remedies and natural medicine is parsley. Parsley is a vegetable and herb that we eat that has the ability to destroy and dissolve cysts, not only in the ovarian area, but in all our bodies. So parsley is good to dissolve cysts and tumors. CLA is an oil that comes from milk and meat that is really good when you have the polycystic ovary, because it works in the pancreas, helping us to produce better insulin to reduce the insulin resistance that make us gain weight. And then DIM is made from broccoli and cauliflower, all the crustaceous vegetables, that helps to eliminate too much estrogen. That's the main problem that people have when we don't have a good health in the ovaries, too much estrogen. So the DIM flush it out. Another thing that is important to flush it out is to do a liver cleanse. So I always ask people, how old are you? Have you ever had a liver cleanse in your whole life? And the liver is the main filter. So when we have too much estrogen, we need to keep a clean liver, because it will help to flush out all the bad estrogen that can cause disruption in the female organs. And then instead of using all these artificial or synthetic hormones, my recommendations will be to do herbal mimics or herbal supplements that will help you to replace hormones naturally, like Vitex and Don't Quai. So remember, support your thyroid, take parsley, CLA, DIM, liver detox, and take Vitex or Don't Quai if you're facing any problem like hot flashes or menopause symptoms. And that's all that I have today. Remember to like it and to share with other people, and that way we can reach more people, your family members, your friends, and subscribe to our channel. I see you next time. Thank you for seeing us. Bye-bye.